So as we continue to work on Erica, and what I'm doing actually is I'm applying sustained pressure in patterns to the muscle. Muscle is very actually simple stuff, but it's wonderful stuff because muscle really does only two things: it expands and contracts. And when it gets into trouble, it goes into sustained contracture. So in Erica's situation, uh, the glute that I'm in right now, which most people think, well, that's my butt muscle. Well, not really. It is, but it's your key postural muscle to your body. And so it has a very, very important task. And a lot of times when the glute gets into trouble, like Erica's does, it's going to feed into her low back and it's going to give her a lot of low back pain. And so I'm going in and I'm going to release all of these trigger points out of the muscle. Now, what do you do once you release the trigger point? The muscle starts to relax, but it's kind of talking to the brain, going, really, what do you want me to do? And the brain's going, well, I don't know whether I want you to tighten up or if I want you to start relaxing. So that's where corrective exercises come into play, where we start to loosen the muscle up now. I'm going to give you some very simple but important movements to do to help that muscle understand that it wants to stay in its lengthened state. It doesn't want to go back into spasm. And so myotherapy is really a two-part technique to relieve pain of muscular origin and restore muscle function, to get muscle working again. A lot of people, I had a woman come in to see me the other day and she could not have any, she had no rotation in her shoulder. She had slipped in a yoga class and basically the rotators on the back of her shoulder had shut down. And so we had to kind of go in and wake them up and then start her through her full range of motion. And after her first treatment, she had a lot more range of motion back because we kind of woke those muscles up. They're going to do what they have to do to protect themselves. And so we had to change that. Sometimes in protection, they want to stay in contracture. And we don't want them to do that. We want them expanding and contracting. And so this is the way that this technique works, and it's got about a 95 to a 98% success rate.